On behalf of the Northwest Mental Health Technology Center, welcome to today's webinar, Pandemic Pivots, Lessons Learned from a Peer-Run Organization. We're grateful so many of you could join us to learn more about this important topic, and we look forward to sharing and exchanging information with all of you. My name is Adrienne Scavera, and I'm the Training and Outreach Director for Mental Health and Addiction Association of Oregon, or MHAAO, one of Oregon's oldest and largest peer-run organizations. I'm presenting today with my colleagues, Raina Bauer and Terry Lecron-Myers, Evolve Department Directors. The MHTTC network is a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration, SAMHSA, with the purpose of disseminating and implementing evidence-based practices for mental health disorders into the behavioral health workforce. The Northwest MHTTC is based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. The Northwest MHTTC provides training and technical assistance in evidence-based practices to Region 10 of Alaska, Idaho, Oregon, and Washington. There are a lot of great resources available on the Northwest MHTTC website at www.mhttcnetwork.org/Northwest, including upcoming free events, online courses, products, and research briefs. We could not do this without the support of SAMHSA, and of course, this content is not reflective of any SAMHSA official positions. Now, a little bit about language. It is our intention to always be mindful of using language that promotes recovery and culturally appropriate terminology. We encourage everyone to use and champion person-first languages, which emphasizes the individual, not the condition or diagnosis. We do have a couple logistical things to review now. First, we have the chat box, which is where you can share any technical issues, non-content related questions, etc., as these will only be visible to us and the Northwest MHTTC staff who are assisting. The staff may share things that come up that aren't strictly content related in the chat box. We also have the Q&A box. Your questions are extremely valuable to us. Because of our group size, everyone is muted automatically, but there are two ways that you can ask questions. You can type your question into the Q&A window, and everyone will actually be able to see all of the questions and upvote any questions that you see as relevant and would like to see answered as well. And today we all will be remaining muted during this webinar, so the Q&A box is going to be the option available for the questions. If we aren't able to get to all of the questions during this webinar time, we will make sure to get a response to you afterwards by following up. Your feedback is important to us, and we have a short survey at the end that we'll share via the chat box and an email as well. The survey is anonymous and helps presenters plan future sessions. We are not able to provide CEUs or continuing education units for this series, although everyone will receive a certificate of participation. Our slides and other resources will be posted after this session to the MHTTC website as well. At this time, I would like to introduce myself and my colleagues, Terry and Raina, and we'll get started with our presentation on how we have adapted service delivery, trainings, and supports for the peer workforce in response to the COVID-19 pandemic. As the Training and Outreach Director for MHAAO, I work to support the peer workforce from initial entry and training to systems level advocacy, while using both my lived and professional experiences. And joining me today are two fantastic peer support leaders. Terry Lecron-Myers is an accomplished community director with proven ability to develop trusting relationships as a liaison for internal and external teams and community partner systems. Terry currently serves as Evolve Program Director for MHAAO. Raina Bauer, Evolve Program Director, brings a wealth of lived experience in peer support and management. As a leader in the recovery community, Raina supports all people that are in need of mental health and substance use supports. And I want to thank both Terry and Raina so much for being here today with me. And I'm really excited to hear all of the incredible information that they have to share with us this afternoon. So we're here today for the Pandemic Pivots webinar, and we will be talking about the changes, growth, and lessons learned from us as a peer-run organization. And I'm also curious to see who all is with us today. So I'm going to launch a poll so that we can better see who is with us. So you should see a pop-up. It says, which of the following best describes your role? Please select the answer that is most accurate for you. I see a bunch of responses coming in. Excellent. Thank you all for filling that poll out so quickly. See, we've got a good deal of administrators, peer support specialists, and a lot of folks saying other as well. I'm going to leave this poll up for about another 10 seconds, and then I will close it and share the results with everyone. So thank you as folks continue to select which best describes your role. All right, I am closing the poll. And it looks like actually 28% of people, the largest category, other, felt that none of those accurately reflected your role. Next, we had administrators, followed by peer support specialists, followed by social workers, peer supervisors, clinicians, and finally, with our smallest number at 5%, smallest percentage at 5%, peer recovery specialists. Well, I'm excited to see that there is such a wealth of different roles that are here today. I know everyone brings a different experience, so I'm really excited to share our webinar with all of you today. So thank you so much for being here with us. I want to briefly take us to our agenda. We're going to be going over an organizational background for MHAAO. We'll then be taking a look at the pandemic pivots related to services, our peer support services, training, and our staff and workforce supports. We'll then be going more in depth and reviewing the takeaways, the lessons that we've learned as a peer-run organization, as peer support providers, as training providers throughout the COVID-19 pandemic. Finally, we'll have some time for those Q&A questions. So please do type in the Q&A box if you have questions that come up. We will be reviewing all of those at the end. So I encourage folks to just ask your questions as they come to you, and I look forward to reviewing them. And now Terry is going to be sharing some information on the background of MHAAO.
Good morning or good afternoon. So Mental Health Addiction Association of Oregon is an inclusive peer-run organization dedicated to self-direction, honoring the voices of lived experience. We are a peer-run organization, meaning that we are led and staffed by people with lived experience, including at least 51% of our board directors. The services provided by MHAAO include direct peer services, training, technical assistance, and consultation, all from the peer recovery perspective.
Thank you so much, Terry. The global COVID-19 pandemic really changed life as we knew it. We experienced impacts personally, as well as within our organization with respect to our peer-delivered services, training, workforce supports, and operations. Terry and Raina will be taking us through changes and expansion amidst the pandemic related to our direct peer-delivered services programs. But before we do that, we have another poll for all of you, so I will be launching that right now. The question is, the COVID-19 pandemic has impacted my organization's services in a considerable way. Strongly agree? Agree? Do you neither disagree nor agree? Do you disagree with that statement, or do you strongly disagree with that statement? I'm going to leave this poll open for about another 10 seconds. I see the responses are coming in really quickly now, so seems like this is not a poll where people are deliberating, but have a pretty quick reaction to. All right, thank you all so much for participating in that. It may not come as a surprise. I know it's not a surprise to me that almost 3/4 of us strongly agree that the COVID-19 pandemic has impacted our organization's services in a considerable way, followed by almost neatly 1/4 agreeing that the COVID-19 pandemic has impacted our organization's services in a considerable way. And we have a very small amount, one person each, who is neither agreeing nor disagreeing, and then one individual who disagrees with that statement. So for the vast, vast majority of us, we do feel that the COVID-19 pandemic has impacted our organization's services in a considerable way. Thank you all for participating in that poll with us. So now Terry and Raina are going to sort of set the stage here in terms of the changing context amidst COVID-19 related to peer-delivered services.
Thank you, Adrienne. I'm going to have Raina start with the backstory of how and what we noticed at the very beginning. So Raina.
Hi, everybody. My name is Raina. And in thinking of this back when the pandemic first hit, and to kind of just create the picture of, you know, when our peers are first meeting the individuals that we serve, I think I want to specifically focus on the houseless. And, you know, before the pandemic hit, we were able to, you know, people that were houseless were able to access showers and access the facilities, to use the restrooms, use charging stations at public places. And, you know, some of our individuals that we work with or that we get to support didn't even realize that the pandemic had hit. So what would be a normal day that they would go to access these resources were all closed down one day. And so restrooms became void. They weren't able to use the restrooms. They weren't able to charge their phones, which kept them in contact with their natural supports or with their peer support specialists. And so at the beginning, our peers really worked on building relationships within the houseless individuals that we served by, you know, asking permission to go in the camps. And that way, when we showed up, people weren't surprised and our peer support specialists felt safe. And so we knew where our houseless people were staying. So when the pandemic hit, we were able to locate our peers, not only locate them, but maybe, you know, bring biodegradable toilet paper or offer our peers vehicles to charge their phones so we could still stay in contact. You know, we went to Zoom, you know, to the social media platform and, you know, assuming, and all of the recovery meetings that people were attending. And, you know, assuming that people knew how to access that was something that we didn't do. You know, our peers were still able to meet with the individuals, get their phone charged, get the Zoom link downloaded on their phone, and keep people connected. So I think that's really important to highlight. We noticed increases in overdoses, suicide, child abuse, domestic violence. Terry, I'll let you talk on that a little bit.
Okay, so just one of the things that I noticed when Raina was talking about the getting the people transitioned from in-person supports to telehealth or just electronic technical supports, we were able to see that the recovery community was able to transition the probably the easiest, because they were so desperate to making sure that they stayed in the solution, and that this was really they recognized that this was really a hard time. And so they knew that isolation was one of the things that would probably not be as helpful to our peers. And so they reached out and really got trained up on the technical parts of things. And this was for every generation. Our older adult programs were motivated to getting connected somehow, some way. And even though there was resistance of, I don't know how to use the phone, I don't know how to get this going, our peers and the community partners all rallied in, and we were able to get funding for either able to get tablets and additional phones, as well as get the technical support for the people who we were serving. And that also included our own staff peers, because they are not necessarily, they were technically challenged as well they weren't familiar with the different electronic platforms that you can have meetings, from Google Meets to Zoom to even how to get online to talk to their doctors and get onto telehealth. So there was a huge amount of work that needed to be done in the background to get people prepared for the technology, the way of communications and technology. And with that said, we did notice that there was a lot of things that were happening behind closed doors. We had more reports of people having domestic violence issues because they couldn't reach out and they didn't know what services that they should go to, and things were closed down. And so a lot of in fact, we were able to open up all of our staff who were willing to be on call. They were volunteering their phone numbers online to give that additional support of moral support or emotional support or spiritual support, whatever it was that they needed, so that they to reduce people not being able to get services. And when we talk about child abuse, it was the same category as domestic violence. The frustration, the fear, and the worry in these homes were being acted out in some of these different ways. And we did get an additional fund for suicide prevention, because we had noticed that isolation and the voices that people hear a lot of times will tell them to harm themselves. And so there was, so all of these, it was already something that we recognized people needed supports in substance use disorder as well as mental health supports. But it was more, it seemed like it was more urgent and vital that no matter what happened out there in the world, that we actually still stayed steady and stayed the course with our peers and our people to serve the community, because they needed it more than ever. And there was some organizations that did pull back and did not feel comfortable with serving peers in person. And some of our, like Raina said, some of our people were on the trails and they were houseless, and they could not, I mean, there wasn't any affordability to not serve people. And with the additional supports with supervision, one of the things that we noticed is not only did the peers out in the world need additional supports, but our own peer staff were needing to have additional supports, either from EAP or being able to, in fact, we did additional supports by having peer support for peer support. And we had check-ins that helped people learn how to breathe and do breathing exercises and meditation. Because if we emphasized healthcare or self-care for ourselves, because if we couldn't take care of ourselves, how were we going to be expected to support and care for others? And so we found that to be one of the most important things to do, was to have a larger supervision session, to be able to provide additional resources, and to and just kind of have more check-ins, and whether it was in person or whether it was on Zoom, and having more connected phone calls through FaceTime, or just to do the physical check. And I'll let Raina talk to you about the importance of harm reduction. Raina, do you want to talk about harm reduction?
Yeah. So what we've noticed, and what MHAAO, that really values, is person-directed, centered plans, and really meeting peers where they're at, and what they want to do. And so we are really pro harm reduction. We've noticed that even when people are have wanted to access services during this time, that there's been a delay in that. And so it's been really important. I sit in on, the Tri-County, I'm able to see, track OD maps, and we've noticed all of the increases in overdoses. So really making sure that the people that we serve, if they are in active addiction, that they have fentanyl strips, taking the elephant out of the room of all of the people that we've lost due to, due to overdoses, and really making sure that everybody has Narcan on them. So if they are continuing to use, that they don't die, right? And then also making sure that people are getting connected to needle exchange, so we can reduce, the diseases that come with sharing needles. I think that, making sure that everybody who's in active addiction has Narcan has been extremely important. Fentanyl strips, I think it's more apparent in the days now that people have them. So like I said, if they are continuing to use, that they're checking to make sure that if they're going to use, that they don't die. And then on here it says just making sure people have a safe place to live. And Terry, you kind of added that in. I'll let you speak on that. But yeah.
So one of the things I forgot to also mention in regards to how we connect with people electronically is that we all had to learn how to connect with our peers by having the singleness of purpose of looking into the camera and reaching into speaking to the other person, and not multitasking, and really truly being present in the moment to capture the person, to see if there was any clues, physical clues, the subtleties of our tone, of being able to see when someone is looking confused, or being, it was one that I found that we really needed to take lessons. In fact, our executive director was given lessons on how to speak and talk to the camera so that she looked like she was really connecting to her audience. And so with that lesson that she taught me, I was like, well, that's what we need to do with our staff as well as with our peers, is to be 100% present, because in today's times, we tend to multitask and look at one thing and another thing, and before you know it, we might have forgotten what the other person said, or we might not appear as engaged. And so, and then another thing that we found is that meeting people where they're at, we had to recognize that there was multiple ways to communicate, and not everybody is comfortable with Zoom, and not everybody was comfortable with having their face on a telephone and chatting. And so we had to start asking the questions. How would you like me to support you? Are you comfortable with being at a park? Are you comfortable? What would your preference be? And just kind of, and then being able to, I think this is probably going to go into the next slide, but just being able to know more about how to protect yourself and others while you're out social distancing. And so when we talk about what are some of the changing context of amidst of this, it was, so the similarities is that we want to continue to connect with our peers and to prevent the isolation. The part that is the changing context is that the isolation is already in place and physically you're not as accessible. You can't just pick up someone and take them for a ride in the car, and having to have alternatives to transporting. We did start transporting people in the backseat of the car and having them sanitize and mask up. But it was about being able to be sensitive to all the changing things that were required and asking the peer where were they at. Some people felt like the mask was making them feel like they were suffocating, and being able to think of alternatives of how can we communicate without the mask? What are some of the other venues that we can use? So we had to get really creative with that. I'm not sure that I have anything more to say about this particular slide. Adrian? Oh, look at that. So, so direct services, a lot of our services became virtual. I know that our Kaiser peers and OHSU, the hospital peers, all became virtual and doing more of the telehealth style, which that in itself was a practice of patience with each other, learning how to click in at the right time, how to chat, how to recognize when someone is raising their hand because you didn't see the emoji. There was just so many different things that we all had to become aware of, and how to respond to people. And then also being able to teach our peers what are all of the things at the bottom of our screen that is happening, and how do you meet those needs. And so there was some in-house trainings, as well as we were a little awkward at the beginning too. We all kind of felt like we were forging through areas that we'd never been through before. And so there was times where we made mistakes and recognized that, oh, we were on a Zoom and the other person was on Google Meet. And so learning how and why technology was the way it was, and inviting people to the right meeting. And then when we talked about increased one-on-one supervision and daily contact, for some people, they did not want the daily contact, but it was, again, meeting the peers where they were at, and also finding out, we also had to recognize that our program managers were, they were getting close to compassion fatigue, and that we had to really start emphasizing the importance of scheduling their time so that it had a little gap of a break. Being able to serve our peer-delivered services effectively also meant that we had to focus on our supervisors and program managers and our peers to look at the calendar. There are sometimes I would look at the calendar and realize that someone was scheduled back to back to back to back, and that was where we had to start, setting up some guidelines of, how about if we just give yourself a half an hour break in between? Let's have you have some time to have lunch, because when people started working from home or in a different capacity at work and in a virtual setting, they they still, it almost seemed like they had more work to do, or they would forget to take more breaks. And so that was one of the changes that we had to remind and practice with our supervisors. And then also being able to be more organized with our calendars, so that we were able to be supportive to our peers that were in the field, as well as our peers that were at the hospital settings. And so as we've talked about already, staff needing additional training and support around technology. The technology can be so big and vast for people who are not generally technology people. Peer support services is about relationship building, and it is about being where and being present. And it was hard to add technology to the whole services field, because if we didn't get on board with supporting peers with around technology as well as our staff peers, we weren't going to be able to be as effective. And so we had to learn. We've had a lot of lessons learned on technology and reporting, and had to increase our electronic platform with a new system that allowed us to do be able to, so the electronic platform allowed us to either text with the peer and it was still documented, or we could do a recording, a voice recording that would go into the documented records, and or it could be like a FaceTime one-on-one session, and so and or a telephone call. So we were able to have an electronic platform that allowed us to have 4 different ways of engaging with our peers. And then as we got better at learning how to protect ourselves with PPEs and hand sanitizing, and getting the lessons learned from the hospitals, then we were also able to start doing more one-on-ones at parks and outside. So I am, oh, look at that. She's got this going on already. So safety protocols. I'll take this one, and then we'll have Raina talk about the external services. So the safety protocols for staff and people receiving supports, I was fortunate enough to have my husband, who works as a respiratory therapist, be able to show me what are the things that are what does a good fit look like on a mask, and being able to get services and supplies from our funders on PPEs and face shields and hand sanitizing, and then being able to train people on, being able to say, okay, so if I'm going to meet you in person, these are the things that I am able to do. And these are the things that if you want to meet in person, I would need you to protect yourself and others by hand sanitizing and putting the face mask on, and then allowing a person to choose whether they wanted to meet in person or whether they wanted to meet on the computer or technology platform. So with that said, we were able to train our new staff on how to protect themselves as well as each other. And so I feel like we've been pretty successful with that. Raina, if you want to take it away with the external services that we collaborate with.
Yeah, I think that many of our programs involve individuals that are going through the DHS process, and also potentially court hearings. In the beginning, they've all went online. Nobody's really going into DHS court. We have FDM meetings, family decision meetings, criminal court cases. We have mental health court. We have And, it's taken a while, but we've developed relationships within the DHS agency, as well as the courts in Multnomah and Clackamas and Washington County, where we're able to be zoomed into that meeting. So to offer support, before via telehealth, and then meet our peer virtually while they're going through their court case, and then be able to connect with them afterwards. As far as recovery meetings go, we have a wide variety. We all know that of recovery meetings in the Tri-County area, whether it's Smart Recovery, DDA, AA, NA, Parents Anonymous, many that I probably haven't listed, but they've all went virtual. And there's a website that people can go to online, and people are able to still stay connected to their community and their recovery community, whatever recovery of their choosing. And so that's been just pertinent to people's mental health and their own personal recovery, to be able to stay connected. I've heard from, and I am a person with lived experience, and I've heard also from some of the people that we serve, when some people have been around for a long time and they're on their recovery journey and they've done recovery one way. And then when the pandemic hit and we were no longer able to, participate in recovery the way that we once did, people felt isolated. And so, and then, people who are getting, wanting to engage in services, the wide variety of services during the pandemic, and not being able to have that human connection. It's been amazing that our community has really connected people virtually. And so the transportation changes, Terry touched on it a little bit, but for a long time, we weren't able to transport people in our cars. And, I think of one instance, somebody was willing to do whatever they needed to do, and they wanted to go into Hooper Detox, and you have to be there by 7 a.m. And normally it's really easy for us to just pick somebody up and make sure they're down there. And, to be there on time so they can access detox. And so, what we've been able to do is the peers have been able to, meet the individual that is wanting to get or needing to get to services. And this is before we were putting people in our cars, and be able to take public transportation down there with them. That's something that we did. We are transporting now case by case, but really using, following the CDC guidelines, using, hand sanitizer and PPE, and disinfecting when people are getting in and out of our cars.
Some of our providers also are providing taxis and Ubers and Lyft at their expense, the provider's expense. So that's been nice to know that there are some, there's people who are willing to go to any lengths to assist with the transport.
Thank you, Terry and Raina, for all of these examples about the changes that have happened within our direct peer-delivered services programs. I know there's also been a lot of growth. I mean, really incredible growth. So I'm wondering,
there you go. So did you want me to talk about the growth, Adrian? Yes. Okay. So what we found is that due to the quarantine, and also we had a very high unemployment rate, we had increased need for shelters in all tri-counties. So we were able to provide services for the Washington County Shelter Program that included working at the shelter, the RV park, and the COVID isolation motel in Washington County. And that was a 30-day contract that gave us some practice on how do we serve people effectively and safely? And so then the next month we were able to receive fundings from Multnomah County through the Volunteer Isolation Motel. And that is where there is over 130 beds or rooms, and some can have families and children that are needing to be quarantined, and they can stay for 14 days. And during that 14-day period, they're able to get services from our peers. Our peers will deliver food during the breakfast, lunch, and dinner time, and during the time that they're just passing the food to the hotel guest. And then they will also give them their business card and say, if you need anything, please call me. And so we've had the guests call our peers that are on site at the hotel. But because of COVID, we couldn't have everybody be in the lobby. So we have scheduled times for our peers and the guest hotel to work on exiting plans if they're there for 14 days and they need to find some additional housing, or they need to be transferred to treatment, or there are some additional other services and supports that are needed. Our peers are able to provide the triage services that are needed in that particular program. Then we also were able to receive the FEMA Crisis Counseling Prevention, which FEMA finally decided or recognized that this was a natural disaster. And so with that, it was needing to make sure that we reached out to every underserved population of people to either give them information and education around the virus, as well as where can they get tested. And then now that vaccines are being not passed out, but anyways, they are being distributed, we are able to give information about vaccinations. And we found that we needed to reach the underserved populations because there was a lot of multifamily houses of people that needed more education, information, and resources, as well as not only just the resources of COVID, or it was also about what happens when we are in this pandemic of needing additional food, needing additional supports around how do you get through this without or having the anxiety and the depression come up, and some people never experiencing and not knowing how to do it. So these are some of the programs that were specifically in response to the quarantine and the virus. And then Kaiser also recognized that there was needs for additional services, and so we expanded that program by 65%. So that was kind of amazing because we had not had contracts with Kaiser until we reached when people went into isolation. And so they found that they needed to have additional supports. And so we were able to work with them. And then Department of Labor Pathway Homes was an opportunity for us to do reentry and reaching into the prison systems and be able to assist with supporting people with employment, housing, and training, and other additional supports. We have the Multnomah County COVID Community Outreach, because there's so many different contracts out there. We found that there was a need for someone to be not generic, but someone who was the additional support to all of these other programs. And this person, the outreach person, is specifically reaching out to the shelters, the food lines, to the houseless population, and supporting them with, we also were able to get some Multnomah County Peer Services funds that allows the people to work with the houseless population in getting them into sustainable housing, and or if a person is in jeopardy of losing their housing, that this fund is able to also assist with that. And then the Blanchet House is another place where we have peers there. In fact, we're going to be, we have one peer that works the food line as well as supports the residents at the Blanchet House. But we also are going to be creating a position that is supporting the peers in the evening between 11 and 7, because we found that there's a lot of people who are having trauma and are not able to sleep at night. And so just having someone available to get additional supports in the middle of the night is valuable for them. And then the Bureau of Justice Administration is another Multnomah County fund that allows for reaching into the jail systems and transitioning people out into supporting them with treatment, housing, education, information on where can they find the supports that maybe got them into the justice system in the first place. So I think that's it.
Thank you. Thank you so much, Terry. It's really incredible to hear about the growth that has happened. I know that peer support is so important now more than ever, and just the increased access to services and increased availability of peer support is really something that's incredible. So as we saw growth within our organization and external organizations as well, we also saw a demand increase for peer support certification training. However, as we were faced with these challenges related to the pandemic, like gathering in groups, being able to hold trainings in person, which is really what our training delivery looked like, we had to reimagine what training looks like amidst the COVID-19 pandemic. So we did complete an accreditation waiver through the Oregon Health Authority. We have a state-approved certification training in peer support, specifically a peer wellness specialist training that is also approved or recognized under Mental Health America National as a national certified peer specialist eligible training. And so we modified that curriculum, which was 80 hours, for virtual delivery, and then began to deliver that online after a several month long process of changes, modification, feedback. And at this point, really have seen incredible interest in the online training. And we've continued to provide virtual technical assistance and continuing education trainings as well. We also developed what we call the Oregon Peer Training and Innovation Center, or OPTIC e-learning hub. That has started small. We've started with 2 online trainings, one on trauma-informed care and the other on building trust with the LGBTQIA plus community. So we're starting there because we really developed this in response to the peer workforce saying we still need to be trained, we still need continuing education opportunities, but it became increasingly difficult to do that in person in a safe manner. So we needed to pivot and make that happen online. We are going to be taking a look at what changes we saw within the peer workforce, and specifically we'll be looking first at internal staff supports within our organization, and then we'll be looking at the peer workforce more broadly. But before we do that, we do have another poll for everyone, so I will be launching that right now. The question is, the COVID-19 has impacted my organization's staff in a considerable way. Do you strongly agree? Do you agree? Do you neither agree nor disagree? Do you disagree with that statement, or perhaps strongly disagree? We're going to leave this open for about another 10 seconds. I see a good number of responses coming in already. Thanks so much. I'm going to close the poll in another couple seconds. So if you haven't got that response in, please take a moment to cast your vote. All right, I see answers are still coming in, so I'm going to give it a little bit extra time here. All right. So similar to our question regarding impacted my organization's services, majority of people agree that the COVID-19 pandemic has impacted our organization's staff in a considerable way, with 67% strongly agreeing, 29% agree, and about 4% neither agree nor disagree, and no one disagrees or strongly disagrees with that statement. Thank you all for participating in that little poll with us as we get ready to go into staff supports. Terry? Terry, you might still be on mute. Just check.
Oh, sorry. No, I'm sorry. I had walked away and now I'm back. Well, what did you say?
So just staff supports, would you still like to take on this piece?
Sure.
Perfect. Thank you.
So with staff support, we have probably increased our referrals to employee assistance program. I want to say, I know that I personally have referred a lot of people, and that because it is 6 free sessions, it allows for people to feel like, okay, I can do this. And then we have a trauma-informed care specialist, and she is someone who you can call at any point in time to just talk about how you're feeling, because not only did we have the quarantining, but we also had the fires. And so there were a lot of things that people were going through that needed to have the trauma informed care specialist to hear and be in a safe place. And we also added the peer support for peer support so that people can kind of have support for each other. And then I personally am a huge advocate of art therapy. And so we had an opportunity to have someone go through the process with art mindset, self-care art sessions. And so people were able to get creative, because we all kind of release our stress in different ways. And so for some people it's art, for me it's cooking. But it is one that it was a great outlet for a lot of our staff. And then support from the supervisors, making sure that the supervisors were, they were very present with their people, and asking the underlying questions, and keeping going a little bit deeper of where our staff needed some supports. And recognizing that PPE, especially after we started working in the shelters, I made sure that we had a constant supply of the N95, and we had a lot of donations of the cloth mask as well. But we know that the cloth mask protects you, but the N95 protected both staff and peer. And so we started increasing our supplies on the PPE, and recognizing that we also needed to have some people with the face shields as well. And then we, as soon as the vaccine was released, we were able to go to each one of our funders. Some of them were medical providers, and some of them were county providers. And we were able to get all of our peer staff vaccinated if they chose that that's what they wanted to do, but at least it was available to them. And we gave them a lot of information and education so that they can make an informed choice. And then being able to have web pages, and we created a COVID-19 committee just to make sure that we were on top of the freshest, newest information that was given by the CDC, as well as being able to find additional resources and supports for all people, and being able to provide it in as many languages as we could. And then we have the weekly morning check-ins, the 9:30. It is they call it the weekly check-in, and there is where staff can all decide who wants to be the facilitator. If they have something that they really want to offer, really helps ground them in their day. So we had one staff that was very excited about sharing his meditation practices. So we've had anywhere from the singing bowls to people just reading an inspirational passage. So they're and just being able to talk about, having a safe place to talk about where they're at that moment in time. So that is what we have with the staff supports.
Thank you so much, Terry, for sharing some more information about the internal staff supports. We have another poll, and I know we've got about 5 minutes left, so I'm going to be moving us kind of quickly here. As a result of the pandemic, people who receive services from my organization would like to receive more frequent or additional services. So I'm going to leave this one up for about 30 seconds, so please do get your vote in. This is our last poll for the webinar. I see a bunch of responses coming in. Thank you so much. All right, I'm going to leave it open for about 5 more seconds, and then I will be closing the poll. And I will now close and publish the poll. So 38% of us agree people would like to receive more frequent or additional supports as a result of the pandemic from those served at our organizations. About a third, 33%, strongly agree, followed by 25% neither agree nor disagree, and a very small percentage disagreed or strongly disagreed. Thank you all so much for participating in our final poll. I'm going to real briefly here take us into some workforce supports. We provide peer support for peer support specialists that is led by our trauma-informed care specialist, who is also a compassion fatigue specialist. That is something that is very real and present during the COVID-19 pandemic. We also provide one-to-one meetings with our peer trauma-informed care specialist for members of the workforce who need additional support, as well as free online training opportunities. With that, we're going to take us into a brief review of the lessons that we've learned during the COVID-19 pandemic. I'm going to start us off here, and then Terry and Raina, please do chime in as well. So the number one, I believe Terry already talked about this one, the importance of taking care of ourselves so that we can really be our best selves, whether it's as a supervisor, whether it's providing services directly. Take care of yourself, really an important lesson. We need to remember that those who provide services and those who receive services are challenged alike amidst this global pandemic that impacts all of us. We really recognize the importance of leading with compassion while also having flexibility, empathy, and kindness. We know that business as usual, as it was outside of a pandemic, was not a reasonable expectation to have, and that people are individuals, and that really requires individuality of support that is being provided. We also recognize the prevalence of trauma and the impact that can have on all of us. And it's really important to be trauma informed. And the final lesson that we've got here is the importance of transparency and communicating often. You can't over communicate during a pandemic, especially when working virtually. Terry or Raina, do you have any real quick additions for this one?
I think that this really covers most of what we talked about, but I can't emphasize more about leading with compassion, because what I found is that we're all tired, and we all have our moment where we're not feeling very patient. And at the same time, I always have to sit there and remember, okay, we all have something that is this additional pressure with this COVID-19 experience. And so I think that is, that's why I feel particularly Compassionate about that.
Fantastic. Thanks so much, Terry. We've got one more page of lessons learned here, and then I really quickly want to address those questions in the Q&A. We need to recognize that productivity is impacted during a global pandemic, and that's okay. We need to put people first and also recognize, like Terry and Raina had talked about, everyone is at a different place with technology and familiarity with that. Related to that, not making assumptions is another really important lesson that we are taking away from what we've learned during the pandemic. The importance of boundaries and promoting a work-life balance or integration is critical. And we need to make sure that our practices match our values, as well as being proactive versus reactive to situations or challenges. We also learn the importance of role modeling and taking a look at how do people prefer communications, as well as being mindful of the emotions that we bring into supports and messages and the impact that that can have on our peers or on our teams. And I know we are right at 2 p.m. There's been so much good information that's been shared today. Real quick check-in with my co-presenters. Any additions to that before we very quickly address the Q&A?
I just want to thank everybody for being here, and that this has been truly an honor and a privilege. Thank you.
Thank you so much. All right, so quick look at the Q&A. Jennifer asks, what alternative to masks did you come up with while keeping all parties safe and following guidelines? Terry or Raina, would you like to address that quickly?
So the experience that I had was with our peer from mental health court. And one of the things that he said was, my peer does not want to wear a mask, and he's very stressed out, and I need to meet with him, and he needs to see me, but I don't know what to do. So we had them meet at the park that is across the street from the courthouse, and picked up the telephone and had them talk to each other on the telephone, but could see each other from 3 benches over, because at the time they didn't know what else to do. And so we got creative with that kind of a thing, using the telephone, but being able to see people, and then being able to be funny and waving at each other and things like that. I don't know whether that answered the questions, because what alternatives to masks did you come up with while keeping all parties safe? That was one of and the other alternative was just the telephone, the texting, the emailing, and the Zooming. Those are the ones. And face shields.
Excellent. Thank you, Terry. All right, a question, where can we get the virtual delivery curriculum? So if you're interested in MHAAO's trainings that are being delivered virtually, registration is available on our website, mhaoforegon.org. And I see a question about contacting the MHAAO trauma-informed specialist. So that is also available through the MHA of Oregon website. And folks can see when the groups will be taking place, as well as contact information if you'd like to reach out directly. I see one more question about whether we plan to transition back to all in-person peer trainings once it's safe to do so. I think we might take a look at hybrid options, both online and in-person options, because for accessibility reasons, we've really received some positive feedback with regard to the online delivery, especially for people who may not have transportation or who may live in parts of the state or country that they do not have access to peer training. And I think we are at time. So if we did not have time to answer your question, we will follow up with you, but I want to thank everyone so much. We've got our contact information here. Invite you to reach out. We will be sharing these slides as well with everyone who has attended. And I want to quickly remind everyone that your feedback is really, really critical. So please complete the confidential evaluation by following the link that will be provided in the chat box. You'll also get a reminder email to please complete that. It is really important in terms of helping us to improve and develop future programming. So please take a moment to fill that out. And if you're interested in finding more about the Northwest MHTTC or registering for additional resources or trainings, please check us out at the website www.mhttcnetwork.org/Northwest. So thank you all so much for being here with us today.